everyone, or should I say good afternoon or good day or good morning, depending on wherever you are joining us. Thank you for coming and joining this webinar. You're all very, very welcome. This webinar is organized by Exeltis Africa Limited and hosted by Thummimng in partnership with the National Association of Nigerian Nurses and Midwives, the Lagos State chapter. I would like to say a little about Exeltis. Exeltis is a global pharmaceutical company that specializes in women's health care, dermatological care, respiratory treatment options, and improvement in the health of patients with psychiatric and neurological diseases. I just wanted to know a little about Exeltis. Then I will also tell you a little more about them later as we go on. Now, I have to introduce myself. I've not introduced myself. My name is Mrs. Abimbola Ojo, and I'm a nurse. I'm a registered nurse, a registered midwife, and also a registered nurse administrator. I also work presently, I lecture at the Department of Nursing, Babcock University in Ileshan, Ogun State. Before we go on and before I introduce our panelists and our speakers today, I want to quickly introduce some of our nurses here because it's our nurses week. This week, from the 6th to the 12th of May is the nurses week. And we are doing this to encourage nurses and then to say thank you to what they do in healthcare. So I would like to introduce some of our, acknowledge the presence of the virtual presence anyway, of some of our directors of nursing services who have joined us and encouraged us in on this platform. The Director of Nursing Services from Lagos State, Mrs. Shoni Bare, I'm very sure that she has joined us. You're welcome, ma. The DNS from Ogun State, Mrs. Ojutayo. The DNS from Oyo State, Mr. Ajiboye. The DNS from Osun State, Mrs. Abioye. And the DNS from Kwara State, Mrs. Adenino. Thank you so much. You're all welcome on board. Also, I will not forget some of the workers in the national and in NAM, the chairperson of NAM Lagos. They're actually in partnership with this program. In person of Comrade Blessing Israel, I believe that she's on the platform too. You're very welcome, ma. The PRO of NAM Lagos, Comrade Akinla, and then the chairperson of NAM Oyo State, Comrade Adeyemi. You're very, very welcome. Now, before I introduce our speakers, we have two speakers here today, and they're going to talk about, the first speaker will talk about the topic, safe nursing care and safe motherhood. Then the second speaker will talk about effective prevention of unplanned conception. You know, during this COVID pandemic, people are at home and then things may happen. So we need to know actually about preventing unplanned conception. So before I introduce them, I'll introduce them and then they will come up on board. I'll just hand over to the first speaker and then the second speaker. I quickly want to just say some ground rules and some important information. Number one, this webinar for nurses is going to earn you a 3-unit point for the renewal of your license. And the certificate for this webinar will be available online after you have registered. I believe that you have registered. For those who have not registered that just joined us, I will encourage you to register immediately after this so that, for logistic reasons, so that we'll be able to write out your certificate. It will be available in a week's time, by God's grace, 1 week after this webinar. So I'll all encourage you to register. Then the ground rules, I want, as the seminar goes on, if you have any questions, don't just pen it down. You can chat it up with us. At the end of the seminar, we are going to entertain your questions and answer. We are going to entertain your questions and answer. Then comments will also be screened before we read them out. So I want you to just cooperate with us. So let me introduce our speakers. Our first speaker for today is Dr. Femi Ogunremi. She is the CEO and founder of Monitor Healthcare Limited. Is a well-read medical doctor of high repute. Dr. Femi Ogunremi. I want you to feature Dr. Femi Ogunremi, please. He's the CEO and founder of Monitor Healthcare Limited, and is a well-read medical doctor of high repute. And he has his background in emergency medicine, general practice, and tropical medicine. He's also a medical educator and a keen leader, a keen teacher. So today he's going to talk to us about safe nursing care and safe motherhood. Our second speaker is Dr. Wahil Katab. He's the medical director, Middle East and Africa at Exeltis. He has more than 20 years of experience in the medical field, with special focus on women's health and metabolic disorder. And then today he's going to talk to us about effective prevention of unplanned conception. So I want you to follow along. I believe a lot of people will join us as we go on, as I call in, hand over to Dr. Ogunremi, being our first speaker. Thank you so much, Dr. Ogunremi. Over to you.
Thank you, Mrs. Ojo, and welcome everybody. Let me load my presentation so that I share my screen and we can all see. Okay. Right, so I want to welcome everybody that is joining us from all over around the world. Today I will be talking about safe nursing care, safe motherhood, and during this COVID pandemic. I want to do just a little bit of, I won't say housekeeping, just a bit of additional to the introduction. I'm a medical educator and I do a lot in England around, I work very closely with the nurses around their training to become, independent practitioners and things like that. So I'm not particularly a novice to what the nursing care is all about. And we work together, obviously, for the best of our patients. So today, I will be just taking us through what I expect at the end of this presentation. I will want us to understand what SARS-CoV-2 is all about. I know there's a lot of anxiety around what's going on in the world of, even during discharging our own, duties as nurses, as doctors, and healthcare practitioners. Now, we need to understand SARS-CoV-2, how it's related to nursing, and also safe motherhood. At the end, we should understand the etiology of COVID-19 as it relates to infection prevention and control. Also, the role of IPC, which is infection prevention and control during this pandemic, and how it relates to our work. I will have put us through, maybe remind us again about the principles that is related to cross-infection and chain of infection during this presentation. Now, just a teaser, just to draw us all into this. Let's think about these patients. This is there's a 28 years old lady who is gravid at 2/1 and gestational age 32, is a Nigerian resident. The pregnancy so far has been uneventful, so no issues whatsoever. And she's normally fit and well. She denies any contact with anyone with any sort of strange, diseases. She doesn't smoke or drink and not on any medication, no past medical history. So she's presenting to us with a history of, feeling feverish, dry cough, shortness of breath, especially when she walks, even though she's pregnant. And now she has generalized body pain as well. To her, she feels she's got malaria and she feels flu-y. Maybe she's got flu as well. Now, when we examine, and this is very important because nurses usually, we're at the forefront. We are the one to triage most of these patients. So we're the first person that this patient will meet before we triage and get Dr. C. So this patient looks flushed. She's coughing, dry cough, and then she got a temperature of 37.9. Her blood pressure is 110/60, even though her booking blood pressure is 110/60. So blood pressure today is 100/60. So the question is, what do we think? At this point, will you want to use your PPE, your personal, protective equipment? Please, there should be a question popping up on your system right now. I want you to just tell me whether, if you think you're going to use your PPE at this point, just pick yes. And if you think at this point it's not necessary, let's pick no. We have about maybe 10 seconds to do that. Okay, so, right. So I'll go to the next, we'll carry on with this presentation. This might stay. So now, it is Mother's Day today. And we know that, safe motherhood is quite key. Let me try and take this on my screen. Okay, all right, that's fine. So safe motherhood is really key. And what do we mean by safe motherhood? I think safe motherhood means everything around planning for pregnancy. Whatever happens through delivery, through pregnancy, we should make it safe. Up to the time that we go into, a lady will go into delivery. So we want a safe pregnancy, safe delivery, and we want to take care of the fetus and the mother safely all through the journey. So that is what safe motherhood is all about. There are 4 pillars of safe motherhood. Of importance is family planning. We have antenatal care, and we have, clean, safe delivery and essential obstetric care. So primary health care, equity for ladies, and basic maternal care. Really important. Now I'm emphasizing this because we know that during delivery we have a lot of there could be issues, especially in this part of the world. And after delivery, it is documented that infection is a major issue around why we have high mortality rates. So we need to know how we handle our ladies during this journey so that they are safe from cross-infection, cross-contamination, and then we can, save our ladies in the journey. Generally, we know that infection is one of the leading causes of death in our hospital every year. In fact, WHO, according to CDC, approximately 2 million of preventable infection kill our ladies every year. And then we have about 90 million of unnecessary death, which is actually associated with infection. And a lot of infection will come from the hospital. When we say coming from the hospital, by the way we handle things, either the way we handle our patients, or the way we handle materials, or the way we discharge our duty. And that's why it's very important for us to rub mind around this and then see how we can actually improve things. Now, as if this is not enough, now we have this hitting us. SARS-CoV-2 has come into existence. So we're still dealing with issues around infection. We have not actually sorted it, and SARS-CoV-2 is walking into our world to change things maybe forever. There's a lot of anxiety, there's a lot of panic, and a lot of us are anxious about what do we do? How do we handle this? I know there are a lot of information out there on the TVs and things like that, but it's still a thing of a concern to us. So my duty today is to try and give us an overview of where we are with it and how we can protect ourselves during the process of discharging our duty. So SARS-CoV-2 is a form of coronavirus, like we all know. People say koro today, koro in our world now. It's a big thing. So it's a big family of virus, and they're highly infectious family. They pick their name from the shape of a spike, which is on the envelope, which looks cranny. It's like a crown. We'll see. I'll show us a picture in the next slide. So it's they have this crown-like appearance of a spike. Now they're not new to us because since the 60s we've been in contact with this virus, Around 2002, we had one outbreak somewhere, in the Asian country where we have SARS. SARS is, severe acute respiratory syndrome. And it's actually associated with a particular form of cat called civet cat. And then we have, in 2012, we also have an encounter with this particular virus where we have MERS, which is the Middle Eastern respiratory syndrome, where we have an association of this particular infection with a particular form of camel called Demodrine camel. And now, 2019, like we know, we now have the new coronavirus, which is the SARS-CoV-2, which causes, COVID-19. And that happened, we actually found around December, where we had all this strange pneumonia coming up somewhere in Wuhan, in China, where we identify actually SARS-CoV-2. So since CoV-2 is being in our world, it has been, a lot of panic all over the place. Usually, coronavirus, there's zoonotic diseases, so they're found in animals. But what we discover with this new coronavirus is there's a kind of genetic, sort of a similarity between it and SARS. So it's very, very similar to SARS. And in that form, it makes it easier for us to study this particular virus. In terms of infectivity, we realize that it's highly infectious. It distributes the infection is discharged through talking, through sneezing, through coughing, which I'm going to talk a little bit about it in a second. And then one person having it can distribute it to another 3 people. So in terms of propagation or the spread, it spreads in an exponential manner if we do not curtail the spread on time. So as it looks like, about 3.5 million people are infected worldwide as it stands now, and over 260,000 people are dead from this particular terrible virus. In terms of incubation, it's about 3 to 14 days, for average of about 5 days. And when people have it, like we can see, a lot of people they're just healthy carrier and they continue to charge the infection. In terms of reinfection, we're still not particularly clear whether some people will have it and they'll be reinfected, or when you have it, you build immunity against it. But generally around viruses, we discover that when you have an infection, the body sort of mounts immunity against it. But it's not well, we can't say much about COVID-19 as it stands presently. Temperature, we're not sure how temperature is relating with this, but we know that it hits the Western world during the period of winter, which is when viruses are usually very, very strong. They're strong in a cold environment, but in warm environment, generally, you discover that the infectivity of viruses sort of is subdued. But we're still studying. We don't know how it's going in Nigeria as it stands, but there are a lot of controversies out there. And there's no evidence of transmission of this particular virus from human and from pets to man or vice versa. So I want to dwell in this particular picture that is on the screen. Let's minimize this. Okay, so let me pick this and see whether we can use a pointer. Right, if you look at this particular picture, this is a picture of, a SARS-CoV-2. And what we see here is, you see this envelope, is the envelope that surrounds the virus. And this is the genetic component we talk about. In this case, is an RNA genome. And this is the genetic material that this virus will use to actually, tackle its host. How it does that is, there is a receptor on our body, which is rich in the lungs, called the angiotensin converting enzyme 2, ACE2 receptor. ACE2 receptor can be found in the heart, it can be found in the blood vessels, it can be found in the kidneys, but a lot of it is in the alveoli, in the lung. That's why this particular virus tends to attack the lung more than anything. Now, the crown-like spike that we can see here, which is the glycoprotein of the virus, is what gives it its name, the coronavirus. And that's what the coronavirus will use to dock on this receptor, ACE2 receptor. So it sort of uses that to hook itself on the receptor, and then it will then take over, ejecting its own nuclear material into the cell of the particular host and take over, the activity of the cell, and therefore replicate itself, a lot of it, and then burst, releasing more of its type, and then attack more receptor, and that causes a lot of problem if it's not taken care early enough. So now, in terms of symptoms, let me backtrack a little bit here, because this is really important. This particular envelope, I want to talk about it because it's a like we can see, you have a kind of a glycoprotein that makes up this. So that makes it very slippery. So it looks more like an oily wall, which when it hooks on the body, it sticks on it. Now, the way this virus propagates is when somebody sneezes, or when you cough, or when you talk, or during breathing, you can eject the virus if you're carrying the virus. It's been proven now that even when an individual speaks or they eject this virus in the air, it can stay in the air for the next 8 hours. So somebody can walk into your room or to see you, and they walk out, they cough or sneeze, and the virus is still, still moving in your environment until another person comes in. Possibly if they're not protected enough, they can catch things. So it's really important for us to actually protect ourselves against this virus. And there's a lot of new things that is coming up. And you can't do too much for yourself, protecting yourself at every time you see someone, whether at workplace, whether at home, on the way home, or whichever way it is. Now, if somebody coughs and then they discharge the virus can stick on the surface for average of between 4 hours to even like 3 days. Some even say longer. So your hand can then serve as a vector. You understand? So your hand can then become like a vector, like mosquito, to carry this, because if this thing is dislodged anywhere and you use your hand to touch it, any hard surface is a culprit at this stage. It could be your table, it could be the door handle, it could be the switches on the wall, it could be, it could be your coat, it could be maybe plastic you're carrying, it could be anything that we can just, that can carry any material. So they can get stuck on that, but they stay there because they're envelope virus. They die easily if there's anything to actually, to interrupt with the wall, the membrane. For instance, if you use ordinary detergent to clean the wall at this stage, you're able to take care of it. Maybe on the patient's bed, if we're able to use ordinary detergents up to like, a dilution of about, I think 30% dilution of detergents or Parazone or things, we can use to clean. And when you clean, this will break the membrane. When the membrane breaks, then the nuclear, the control engine, which is the genome, is exposed, and that way it can't function again. Why I'm dwelling on this is because we talk about hand wash a lot. A lot of us might not even understand the science that is behind hand wash, and it's really important for us to know it, because as it is, the envelope is quite slippery. You can picture in your head that you have like oil in your hand. Maybe when you eat something that is quite oily, if you go and wash it with water, there's oil that will still be in your hand at that stage. So think about you having oil in your hand when you're washing your hand to take care of, this coronavirus. Now, 2 ways you can do that. To wash, you get the detergent. Like I said, if you put Omo or maybe clean in your hand and you have oil, you wash it very well. You need to wash it right, at least for 20 seconds. When you do that, you dislodge the oily base on your hand, and then you need to wash it off now by pouring water on it. So you need to wash your hand over 20 seconds to dislodge the virus from your hand and run tap on it for about, just to make sure that everything that you dislodge is washed off your hand. Then you detach and it will die. Or if you're using your what do you call it now? All these things that we carry around, our alcohol gel. If you use alcohol gel, it's a different way by which that works. The alcohol gel is meant to kill it on the spot. So if you use alcohol gel that is not up to like 70% alcohol base, it's completely useless because you need a high concentration of such to actually dislodge or to kill it. Because this time you're not dislodging it, you're killing the bacteria. So when we wash our hand or we use our hand gel, you need to make sure that your hand gel spread over your hand very well and let it be the normal concentration, and that way you can disengage yourself from this virus. I always like to talk about this so that we understand the science that's behind, using hand wash. Now, let's talk about the symptoms of this disease. It's very important so that we know what we're dealing with each time somebody comes to us. So, a common presentation is people feel unwell. They have, a lot of people are asymptomatic, but usually those ones that are symptomatic, they have very mild symptoms. You understand? So they have things like they feel fluid, they feel like I'm going to have malaria, and then they can they might be incubating this virus at this time. A lot of the time, you have in a moderate situation or infection, you have temperature up to 38 degrees. Having no temperature does not mean that you do not incubate the virus. Like I said, you have that window period when you incubate it, they can spread it, but they're not actually seriously unwell, but they are healthy carrier and they still propagate this. The thing about this is somebody can have this, they can take it home and give it to people who might then become seriously sick. So my presentation, they might have no breathing difficulty, they might present with or without cough, or they might be, they might present with other symptoms like body pain and things like that. In severe cases, they might present with even worse situation like breathing difficulty. Sometimes we examine and you have crackle in the hair, in the lungs, and obviously, as the severity gets worse, you find other signs. Especially, you can find dull percussion notes in the chest. They might have all the cardinal signs that you find in severe respiratory distress. Most especially, finding it difficult to breathe. Now, I don't want to dwell too much on the clinical presentation because the focus today is more on safe motherhood, but obviously, these are the things that we still present, whether we're a normal person or somebody, or whether you're a man or a woman or you're pregnant. The symptoms are quite similar. And you can see, like I've listed in this particular presentation. So usually, a lot of people that will have it will be exposed to somebody else that has had it. These days, we don't talk about people traveling again because we now have a large community infection, community infection going on in our environment. So as people are having it, they will be, passing it across to other people. And then they will be coming in with some of these symptoms, feeling feverish, fatigue, muscle pain, some people dry cough, distress, shortness of breath, whether on exertion or even some, in worst cases, at rest. And then obviously there are some laboratories, signs that we can pick, which this is based on the knowledge that the Chinese have actually pushed out there. That what you say is the WHB can be normal, it can be decreased depending on the level of when you are picking these patients, and the CRP might be normal, it might be markedly raised. However, in a lot of the cases, we just have to take, we have to take good history, and at the same time, see what we have, at present, because it's quite endemic now, and the level of infectivity is high. We have to have a high sense of, alertness when we see patients coming in with fever and related symptoms. Now, there are some epidemiological history that is quite important. Usually, before we got to this level of community involvement of this SARS-CoV-2, we normally would say we've been in contact with people who have traveled 2 weeks. But now, I want to change that to if you have symptoms. If people have been in contact with someone who has symptoms or someone who has been confirmed, they will fall into the epidemiological history there. There are a lot of information on NCDC, which we can actually get. Some of these are actually gotten from NCDC websites. So in terms of clinical manifestation, the patients will have fever, they have respiratory symptoms. CT scan usually will give signs at a early phase. Chest X-ray may not be very useful in early phases of this disease, but in late phases you can find, patchy shadow, like opacity in the X-ray, and that's what leads to the ground glass appearance that people talk about, especially in a very, very bad situation. So there are definitions that is important, but obviously for the sake of the care that we offer, the patient might be, there will be a suspected case if you find any of the signs that we talked about, especially from history. They have fever, they're coughing, they're coming in feeling fatigued, they feel they have terrible malaria and things like that. We need to be very cautious. At the point that patient comes in and we're triaging this patient and we think there's suspected case, in fact, we need to actually protect ourselves. Now, it is mandatory for us to wear, minimally to wear a face mask. And when we're at work and we're meeting all these patients, it will be strongly recommended that we use that as the minimum, barest minimum PPE that we need to use to approach all our patients. Not only when they are seriously sick, because they can be healthy. They can even present with something else, and they might be discharging this. And us being at the front line, we need to protect ourselves to also protect other, which are colleagues, and also protect other patients. So there are definitions for suspected cases. Suspected cases would be those cases that we think are, probable cases, the suspected cases that has other signs. So this is a summary of what I told you earlier on. Now, if we have a probable case would be those ones who are suspected, and we've done some tests and the test is inconclusive. So they are still a probable case, or if you send their results on for testing and you haven't actually gotten the result, you should put them as a probable case. And then you need to protect yourself around all these patients. And the confirmed cases are the ones that have had, SARS-CoV-2 symptoms that they're being confirmed from the laboratory. And those ones obviously need to be isolated. Now, it's important for us to understand the chain of infection, because when we talk about this SARS-CoV-2 or even other infections, they're usually a pathogen. So the pathogen here is SARS-CoV-2. And then the reservoir, like we say, are people who are isolated or people who are incubating the infection. So there's usually like this chain. You have reservoir, from the reservoir, there will be a way by which you can actually, you can carry that pathogen to somebody else. And that channel will be the pathogen. Here, we're talking about SARS-CoV-2, should be able to move from wherever the thing is lodged, or from the reservoir, who are the isolated cases in this case, or people who are healthy carrier, which there should be a channel by which we move this virus to a new host. And how do we do that? I talked about the hand signs earlier on. This is where the hand signs become very important. An individual will discharge by coughing, by sneezing, by talking. All these things will lead to discharge of this from the reservoir. And then this pathogen can then move. For the pathogen to become effective in a new host, is either you have a vector like your hand carrying this virus, and then when you touch your nose, your eye, your mouth, you can inject it. It then goes into the receptors to then propagate itself and then affect the new host, and it keeps going like that. And we have many people. So to break this chain means that we want to break the backbone of the infection spreading. So we can either do that by isolation, when we isolate people, or if we can isolate, we have a high community cases, we can do what we're doing now, that we're locking down. And then in our own workplace, we have to take precaution so that if we wash our hand well, if we sterilize our things, or during delivery or things like that, we're very cautious, we prevent this infection from moving and from it to propagate and carry on to the new host. And that way we can tackle this and protect our lives, including the lives of our mothers. So this is just summarizing what I've just said. So an infection will occur only if the chain is not broken. But if we're able to break the chain, we terminate the propagation of infection. Not only COVID infection, even other infection in our workplace. And it's in our hands to actually do this for the sake of our own life, for the sake of the life of our patients, and the sake of the life of our colleagues as well. So, unfortunately for us, fortunately or unfortunately, we are in the front line as a nurse, as a doctor, or other healthcare providers. We know we're in the front line. We're the first person to see these people. There are a lot of issues around the country now where we find patients being admitted, people didn't take appropriate precautions, and then they discover later on that this patient is gone, and suddenly everybody in the hospital is being infected. You know, this is the time for us to put on our hats of protection. We need to protect ourselves. We need to keep ourselves safe for the sake of our own family, for the sake of our, our patients, for the sake of our colleagues again. So it's important for us to understand this channel of transmission, and then we'll break it every time. I hope this will play. Okay. Oh, okay. This is not playing, which is okay. I would have loved us to see how infection propagation happens easily. But this is not playing here now, which is kind of weird, right? Really? Okay, so this gentleman is a nurse. He's washed his hand. He then went about, I don't know, for some of us that have not seen this, he went about.
Skip the laser, it will work.
Sorry?
Skip the laser, it will work.
I should do what?
Skip the laser.
Right. So clean your hands. That's just telling us. So now let me quickly go because of time. So now WHO has given us certain things which things that we need to do. We can see that it's so easy for us to actually spread infection. Very easy. So it's a global problem. It causes, harm to the patients, affecting patient safety. 1 out of 10 patients, get infected while receiving care in the hospital. And then we have 2 out of 3 deaths among hospital-born babies related to infection. But these are all affordable. They're all avoidable, sorry. So how do we then do that? WHO has given us a list of things that we need to, to do. We need to have IPC program. IPC is Infection Prevention and Control Program. And it simply means how, we need to have a program to prevent infection, perpetrated in the hospital, in our own clinic. And there are guides that we can check this out, on WHO website. We might be able to send some of this information to you, things that you might just go through. You need to have a kind of training and education, standard. You need to have you have your own guides, your own SOPs around how you want to prevent infection or minimize infection. You have to have surveys. You have to have way by which you see whether what you're doing is right or not. There must be audits. We need audit. We need to audit what we do. We need to monitor. We need to audit and evaluate what we do. Obviously, for staff to actually have this done, they need an enabling environment. They need the support of the management, the administration, and there must be some funding for it, to be honest. We need, patient care activities as to how we want to discharge this our duty to make it safe for our patients. We need to have a protocol or guideline of how we maintain our equipment in terms of cleaning and sterilization. It's really important. And don't forget, it is all about performance. We need to appraise ourselves. We need to learn to strive for, better results in everything that we do. And obviously, this will involve a lot of these things. Hand wash again. All the information we've been talking about, how to prevent or curtail infection. In cases where we have people who are infected, they need to be treated. Training. Our trainers need to be well educated, really educated. We need to have a way of, vaccinating ourselves. against infection that we know can cause problems that will transmit to our patients. And then we need to manage our needles well. And obviously, a lot of education is really, really important for our patients and even for us, our staff. So I really want to thank you for, for being patient, listening to me all the while. At this point in time, I want to hand over to our moderator. Thank you so much.
Yeah. Thank you so much, Dr. Ogunremi. Now it's time for questions. We entertain questions now. Thank you so much, Dr. Ogunremi, for that insightful lecture. I believe that our participants have been informed. Now we welcome questions. I can't see any question on this chat box here. We welcome questions from our participants. Well, maybe we should go on, I don't know, maybe, so that at the end of it all, we'll take all the questions. Okay. There's a question here that says from Sandra. Thank you, Sandra. How do we prevent the spread of the infection from the new baby? Or if I get it right, is it from the new baby? How do we prevent the spread of the infection to the new baby? I think it should be to the new baby.
Okay, so I can't see that question. I can see there's a question there, but I'm not able to open it. But it's okay.
Sandra asks that how do we prevent the spread of infection to the? I think it's to the new baby, because I saw fro here, but I think
maybe during delivery.
Yeah.
Okay, so preventing infection during delivery. Obviously, infection prevention, like we talked, I tried to put across to us there. We can look at it from various angles. You want to look at the patients that we're taking care of. You want to look at ourselves that we're discharging, our duty. We also want to look at the environment where we are actually operating. So it's important for us to educate our patients prior to delivery, during antenatal period. We need to let them know what's coming. We need to let them know that, what infections are, how they can, get things, pathogens, even in the community or during the time they're in the hospital. So during the delivery, a lot of what we need to do will lie in our own hands as professionals, because we want to take the baby. To do that, are we using our protective, equipment? Some people will deliver children, crude delivery where people will not use gloves, and the baby will they come up with neonatal infection straight away, immediately after delivery. Or the mother herself, people operate on people without using the right equipment, or maybe the equipment they are using is not well sterilized. Then we carry pathogen and introduce during that. So we need to sterilize our equipment well. We need to be very, very vigilant even after delivery as to if there are signs of puerperal infection or things like that. How do we manage it? You understand? So that we don't leave things for too late. So those are the angles we have to look at it. How we, as healthcare practitioners, how we undo our equipment, how we deal with the patient during the process of delivery. Is it a sterile or is a sterile environment that we're doing all these things? And then after delivery, we also need to have a high level of vigilance. Okay. I hope that answered the question.
Thank you so much.
Oh, there are more questions now.
Yeah, so many questions here. Someone is asking, Lola Afolabi says, does it mean we continually wash hands or always wear gloves? What's the best approach?
Okay, so both are okay. Washing our hands, wearing gloves, they're okay. But when we wear gloves, we want to wear, when you have a procedure, you want to see a particular patient, wear the gloves sterile in a way that is, it's going to be sterile. Because I've seen people wear gloves in a way that you contaminate even the gloves before you complete the process. So we need to learn how to wear our gloves in a way that is sterile so that we don't, during the process, carry pathogens to the patient. So when we wear gloves, we make sure that one glove for one patient. A lot of people will say they use one glove and they carry it around. Those are the very dangerous people that I've seen, to be honest. You can't use one glove for 2 people or 3 people or 4 people because it means that you're just carrying pathogens all along and you might be discharging. You think you're protecting yourself, but you're carrying a cross-infection, you're cross-contaminating people all along. So it's good for us to know that. So when we want to do something for a particular patient, we can use the gloves. And when we finish using it, we discharge it appropriately and then wash our hands to complete the process. You understand? So you can wash your hands. It's cheaper to use your hand for things than using gloves every time. I'm not saying there are procedures that are sterile that you need to use sterile gloves. For carrying your file or folder and things like that, you might need to wash your hand properly around that. So both of them are effective, but it's just important for us to know when to do things in terms of whether to use your hand or you use your gloves.
Okay. Dr. Guremi, there is a question I saw here that I really want us to tackle. There is a controversy on the spread of the virus via airborne transmission. I will appreciate more explanation on this sense.
Okay.
The question is from Famake Oluwakemi.
Okay. Yeah, so there have been a lot of controversy. Like I said, we know that this virus is a novel virus. So it means that there is a lot of research going on and there will be a lot of knowledge. And that's why, as an individual, don't take anything for granted. Just take care of yourself. Because things that we say it is today, we might say tomorrow that is not again. Because a lot of people are doing a lot of research. It's just the way it is when you get into a new terrain and you don't know how it is. Initially, we thought that this particular infection is not airborne. We thought that it's only discharged by, droplets of infection. That you cough from the pellet. A droplet is heavier. So if you cough, and that thing that come out like the tiny flame, those are droplets. So you can discharge and they can stick on something. That was what we thought. As research goes on, we discover now, oh no, even when you talk, this thing can be you can leave some aerosol in air. This is where we are maybe about a month or 3 weeks ago. Researchers coming out that no, it's not only by droplets. You can actually get it by talking, by breathing. So, and that's why there's this school of thought that you need to wear your face mask because your face mask will still protect no matter how much, how little, than nothing. You understand? So in terms of airborne, yes, as it stands now, there are evidences that is showing that this particular particle can actually move in the same character that we have in airborne infection. But that's why a lot of changes are coming into place and people are now saying, wear your mask all the time.
Okay, thank you so much. Thank you so much, Dr. Guremi. We have some questions that are related here. So I'll just put them together. Someone says in a situation whereby an organization one works refuses to provide adequate PPE, what do we do in that case? If there's no PPE, then what do we do to prevent?
That's a very, very thick and deep question, to be honest.
About 3 people ask that kind of a question.
The ideal situation is for us to use our PPE. Yeah. There are a lot of ethical issues that comes into play. And when we look at ethics, we look at ourselves, we look at the patients, and then we look at the community that we serve. Those are the 3 legs of ethics. So at every point in time, the ideal thing is for the system we work in to give us those things that we need to actually operate effectively. Because we can see what happens around the world. Like maybe not in Nigeria, somewhere up north now, we're losing so many healthcare practitioners because they're not being protected and things like that. The ideal thing is for us to have this, but at the very minimum, it's a very, very that's a very tough question and it's an ethical question. The ideal situation is we operate to make ourselves safe, and then to make our patients safe and make our colleagues safe. And that will hinge on the the administration. And this is why we have to talk to the administrator. So please, we need to get things ready, at least at the barest minimum thing that we need to protect ourselves. It's like you're going to a war, a war front, and you don't have things to actually, protect yourself. It's like unnecessary exposure. And this has led to a lot of issues where doctors, nurses, pharmacists, and all other healthcare, they even abandon hospitals. And sometimes when you look at it, it's so hard to blame some of to blame people in these institutions like this. But we still have that duty to actually take care of our patients. So we need to look at, the way I'm going to leave it is, we have to look at the situation that is on ground. Some of the cases that we have, we need to look at the barest PPE that we have. A PPE will start from even your gloves. It will start from even your face mask. For COVID-19, for instance, if you are managing patients that has COVID-19, the ideal thing is for you to have at least minimum the N95 of FFP3 as a face protection, and you have your garment. If you are directly involved with people who are actually confirmed, that is what would have been ideal. But institutions where people come in and they come in with something very trivial, at least you need the basic protection. You need to cover. You need your face mask. You need your gloves. You need to maintain distance as much as possible, and then take all the precaution you can take around yourself to see. But if you think your life is endangered, of course you have to protect your life. You really do.
Thank you so much.
And it's difficult to answer that question, really.
Yeah, thank you so much, Doctor. We are going to take one more question, and so that we can have the second lecture, and then every other question will probably answer it at the end of the lectures, at the end of the second lecture. So we'll take this one more. Oluwatosin Kehinde, hello, I'm Nurse Oluwatosin. Thank you for the beautiful presentation. My question is, how safe is the use of handmade face mask? That is all over the town now.
Yes.
Face mask made of cloth in the prevention of COVID-19. How safe?
Okay, so I will start by saying having something is safer than having nothing. For instance, if somebody coughs and they cough and there's a droplet that's coming towards you, if your face is protected, you will be protected around that. That's the first place to start. Now, in terms of infection that is, maybe aerosol and things like that, it's quite difficult because the size of the particle will determine what can, there are filtering capacity for different, different face masks. The mask, the handmade mask, the test is for you to try and blow and blow a candle. If it doesn't work, then most likely you are not actually protecting anything. So people tend to put, filters in between the protector, the handmade one. So some of them are quite effective, to be honest, because I've seen some like that. They're well built and then they protect. But depending on what we're thinking of, if it's just to walk around the community, of course, face mask, the normal surgical mask is okay. If you cover yourself with something, it's better than nothing. But if you can even make it better by putting a filter in between your hand, the handmade one, better. And the capacity goes up until you start to go to maybe FFP1, FFP2, FFP3, N95. So depending on what we want to achieve, and we can filter as much as we really have to do. So it's not bad, to be honest. It's not bad. It's just that it depends on at the level that we want to get the protection up to.
Okay. Thank you so much, Dr. Femi Ugunremi. Our participants and our audience will implore you to just have the second lecture, so that after the second lecture, then we'll have all the questions together. So now I'm going to welcome Dr. Wahil Katab for the second lecture, and the topic is effective prevention of unplanned conception. Thank you so
Thank
much.
you
You're
very
welcome.
much.
Yeah.
Yeah, thank you. Thank you very much for the intro. And Dr. Fahmy, thank you very much for this very thoughtful presentation. And it was really very informative one. So let me share my screen first, and then we can go.
Okay. Okay. Wow.
Yeah. So first of all, I want to say something very, very important that I have even wrote it down when Dr. Fahmy was presenting. He mentioned something very important when he mentioned that the safe motherhood during COVID, we should, and he shows a very nice 4 pillar for this. And these 4 pillars was the family planning, antenatal care, clean and safe delivery, and the most important is essential obstetrician care. This was the 4 pillars that Dr. Fahmy was mentioning during his presentation. And from this point, I want to say something. This is for the case of wanted, intended pregnancy. But what about the unwanted pregnancy? What about usually the pregnancy or the news of pregnancy is a kind of good news for the family. But when it comes to be a kind of, I don't want to say a bad news, but it could be something really irritating. And this is what we call it the unplanned or unintended conception or pregnancy. But let me say something very factual, and let me show you some numbers from what I want to say. Let us imagine that, can you imagine that during the every minute there is more than 100 more than 100 unintended pregnancy every minute. And that means by the end of my presentation, there will be mostly 8,100 unintended pregnancy will happen. This is a huge number in 1 hour to happen. Let me watch and show you something more important, that in year 2012, the total pregnancy was more than 200 million pregnancies. Among those 200 million pregnancies, 40% of them was unplanned or unintended pregnancy. Almost about 85 million. 85 million was unintended pregnancy. That means, in average, we have across the globe almost 80 million pregnancy which are unintended, unwanted. And this, by the way, this is very big problem and very big issue to the person, to the family, to the society, and the whole community, of course, to have unintended or unwanted pregnancy. But some may ask, what did the unintended pregnancy means? And let us here unify the definition of the unintended or unwanted pregnancy. And let us differentiate between 2 concepts in the unintended pregnancy. Number 1, which is the mistimed pregnancy. And mistimed pregnancy here, it is the pregnancy itself is wanted, but it is in the wrong time. That means we could have a kind of couple whom are maybe newly married, and they agree together that we will delay to have a kid for a little later on in life, or maybe we have a family which their condition and circumstances right now cannot let them care of the baby. That's why this baby is wanted, but it is in the wrong time. This is what we call it the mistimed pregnancy. But there is another type of the unintended pregnancy, which is the totally unwanted pregnancy. This is unwanted at all pregnancy. And here it is the kind of pregnancy of a family, they may have enough number of children and they don't want to have any more, or happens a kind of pregnancy that happen in occurrence of forced sex, like rape or something, or any kind of circumstances that led the family unwanted or doesn't want this kind of pregnancy. So this is to understand exactly what the unintended pregnancy means. So it's either or mistimed or unwanted pregnancy. But is it the unintended or unwanted pregnancy, is it something common, something very prevalent, or we can see it a lot? Let us see something across the worldwide distribution, and let us focus more in our region in Africa. If we see to the Western Africa, for example, we will find 30% of the total pregnancies are unintended. Northern Africa, mostly 40 or 38%, they are unwanted. And then Eastern Africa, more and more. And then Southern Africa is almost 60% of the pregnancy is unwanted, which is huge percentage. But what about the implication of this? What is the other face of the coin? What is the outcome? And this is what we want to discuss together. As Dr. Femi mentioned, the most important concept we try to achieve is to have a safe motherhood. If we cannot achieve this safe motherhood, that means this is a big issue and this is a big problem. And this is exactly what is the outcome of this unwanted pregnancy. How that you look to this, we can find that the intended pregnancy, almost 50% ended by the normal pregnancy or wanted pregnancy, usually ended with birth, and this is a good birth, but mostly 40% of the unwanted, which is the unwanted pregnancy, end with either or abortion, unplanned birth, miscarriage, and this may lead to a big problem, health problem to the mother and for the baby later on. Let us focus on the first part, which is the mother. What are the consequences that may happen to the mother from the unwanted pregnancy? Exactly, let us focus first that, let us say that the abortion is the main problem for the unwanted pregnancy. Mostly 50% of these unwanted pregnancy ended with abortion. And the problem not only in the abortion, but in the condition that the abortion may happen in, especially in the developing countries where women may have a restrict to access to a safe abortion service. And this is another problem. But what is the meaning of safe abortion? And to understand exactly what is safe abortions mean, we can go to unify the definition as mentioned by the WHO. WHO mentioned that the unsafe abortion is a procedure of termination of an unintended pregnancy done either by people lacking of necessary skills and in an environment that does not conform the minimum medical standard. This is exactly what Dr. Femi mentioning when he mentioned in his 4-pillar, number 1, clean, safe delivery, 2, essential obstetric care. Here, there is no safe delivery, there is no good obstetric care, and this is the unsafe abortion. So let us take it to the other part, which is the number and percentage of this. For the unsafe pregnancy across 1,000 per 1,000 for women aged from 15 to 44 in Africa, where in Africa, in Eastern Middle Africa, in Western Africa, in Northern Africa, in Southern Africa, you can find that it's a huge percentage, mostly 33, 36%, 28%, and this all are unsafe abortion happen. And the consequences of this unsafe abortion is maternal death. Maternal death is the main consequences of the unsafe pregnancy, unsafe abortion. And the maternal death is very, very, very common in Eastern Middle Africa because of this unsafe abortion. But for this, we still have to continue to remembering you that we have a per year 56 million abortions happen every year. 25 million out of this is unsafe abortion. Can you imagine? 45% is the total unsafe abortion that happened due to unintended pregnancy, and this carry a very high risk to the mothers. Let us see the other face of the coin, which is the baby or the newborn. You can put yourself in the shoes of this family, that this is a family for unwanted baby or unwanted pregnancy. And you can imagine, of course, will be higher infant mortality, less breastfeeding, less preventive care and treatment, and more infant illness, and more consequences could happen to the baby, which is contradicting with the ethics and the good care for the baby. So now we have seen what could happen to the mother due to unprotected or unintended pregnancy. And also we have seen the other face of the coin, which is the consequences that could happen for the infant himself. And now let me take you to what exactly the main cause of the unintended pregnancy. It's one cause: unprotected sexual intercourse. Unprotected sexual relation could be for many reasons. Could be for use of or non-use of the contraception. Maybe could be due to contraception method failure, or could be due to discontinuation or swinging between methods of the contraception, or it could be due to forced sex, right? This is one of the also common cause of the unintended pregnancy, which is the forced sex. And now this is the main cause, and this is big problem. So this big problem may be irritating for the person, as I mentioned, for the family, and for the whole community and the society. But what is the solution for this? How can we solve such a problem? If we look for a solution for this, we can find one perfect solution, which is the emergency contraceptive pills. Emergency contraceptive pills solve this problem totally by preventing this type of pregnancy to happen. But let us focus more in what are the unprotected, or what are the emergency contraceptive pills. Emergency contraceptive pills, it's a kind of hormonal method, hormonal tablet, hormonal contraceptive that can be reduce the risk of this kind of pregnancy following the unprotected sex relation. And this is a magical solution because it is very easy to be to administer. Number two, easily to be used, and it is very effective and guaranteed in the response. For this, we have several types of this emergency contraceptive pills. Number one, which is the progesterone-only pill, which is the levonorgestrel, which is available in the market under the name of Gynobil. We have also another method, which is doubling the dose of the combined contraceptive pills, and this is used under the name of YOSB method. And the third one, which is ulipristal acetate, as also hormonal contraceptive, emergency contraceptive pill. So you have three: one which is the Gynobil, and the COC or combined oral contraceptive, and UPA, which is the oripristal acetate. Which of these three are preferred? Which of these three are approved by FDA? Let's go to the next slide to know this. In this type, we'll focus first on the efficacy of this type of contraception. If we can imagine that there is 100 women who had already unprotected sex relation, based on this 100, if there is no method has been taken, out of them, 8 could be pregnant. If this 100 use the uripristal acetate, almost 1 only get pregnant. If they use the Gyno-Bel, almost 1 will get pregnant. So efficacy between the Gyno-Bel and oripristal acetate, both are the same from efficacy point of view. But what about the safety point of view? We will see that the safety margin and safety of Gyno-Bel is much higher than the oripristal acetate. What other one is the USB method, which is the combination of the combined estrogen progesterone tablet, which is called as USB method. In this USB method, the 2 will get pregnancy, means it is double the prevalence or double the incidence with the Gyno-Bel. Based on these 3, let us see which of them already approved by the FDA and why and how can be used. If you look to the levonorgestrel 1.5 milligram, which is under the name of Gyno-Bel, it is approved by the FDA. Yes, it is approved, and it can be used up to 3 days. What that means to be used up to 3 days, that means it can be taken in the first day of the relation or second or even the 3rd day, and it will show effective prevention of this pregnancy. Combination or the combined oral contraceptive, it is not approved by the FDA, but it shows some efficacy and it can be used up to 5 days. And finally, the oripristal acetate, also approved by FDA, but is not recommended due to high side effects of this type of medication, and it can be used up to 5 days. And now, let me take you to other ways of prevention of this pregnancy to continue. Number 2, which is a copper or a kind of intrauterine device or mifepristone. Mifepristone and the copper intrauterine device, these are not preventing conception, but they are inducing abortion. So mifepristone, it's a kind of medication that can be used up to 60 days of pregnancy and it induces abortion. And copper intrauterine device also induce abortion. And you know, in some countries and some religions, these types of abortion or inducing of abortion is totally prohibited. And this is the difference between Gyno-Bel and this method, because Gyno-Bel prevent conception, prevent the process of conception itself, while in this method, it induce abortion, which is big difference between both of them. So what is the mechanism of action that Gyno-Bel works by? How this Gyno-Bel work? The main mechanism of action of Gyno-Bel, it's interfere with the process of ovulation. So it prevented the ovulation to happen. By preventing the ovulation to happen, of course, this will prevent any kind of conception to happen as well. And here, let us focus on one very important point, that Gyno-Bel does not inhibit implantation of the fertilized egg. I mean, if the egg has been already fertilized and reached to the uterus, so it will be implanted, it will not, the Gyno-Bel will not induce abortion for this, but it will prevent the ovulation and will prevent the sperm to reach up to fertilize this egg. I will show you in the next slide. The most important second point is gynobil does not cause abortion. That means if it is taken by mistake in case of pregnancy, gynobil has no teratogenic effect on the current pregnancy, or it doesn't have any abortion induction for the current or existing pregnancy if there is pregnancy. The second way how gynobil works, see, it works by one of the three ways. Number one, as we have mentioned, to prevent the ovulation. If there is no ova come out, that means there is no pregnancy. Two, it prevents the sperm to come out from the cervix by thickening the mucosal surface of the cervix and will prevent the sperm to come up to the fallopian tube here. Or the third one, it will, if the fertilization happen, it will stop the movement of the fallopian tube, so it will stop the transportation of the fertilized egg to come and to be implanted here in the uterus. So these are the three main mechanisms of action of how gynobil prevent conception. Number one, by preventing the ovulation. Number two, preventing the sperm to come up from the cervix by thickening the cervix mucosa. Number three, stopping or delaying the movement, the peristaltic movement of the fallopian tube. That means if there is fertilization happen, this fertilized egg will not be able to be transported into the uterus and implanted in this uterus. So this is how it works. But is there any side effect for the gynobil? What kind of side effects that we can see? Let me tell you that gynobil has a very well tolerated and leave the body within a few days. I mean, it is very safe product. And that means also this can be taken by any woman under any circumstances, whatever the timing of the taking or the administration of the tablet. But in some cases, there is some irregularity in the bleeding that may happen after the ingestion of the gynobil. And by the way, this irregularity in the bleeding or the cycle may be irregular. This, by the way, this is a very common kind of side effect. It could happen with any kind of hormonal contraceptive. Anyone taking hormonal contraceptive, the irregularity of the cycle is very common there. So it is not something related to the gynobil, it is related to the hormonal tablet itself. Some other, which is less than 1% or 2% of the cases, they may have some nausea, abdominal pain, fatigue, headache, but compare this very minimal side effect to the concept of preventing the unwanted pregnancy. And now the safety margin. Yes, I showed to you the could be some side effect what could happen, but what about the safety? The gynobil 1.5 milligram is very safe. There is no known serious complication with gynobil. Gynobil also does not cause abortion. That means it's very safe to be used by all women, including the adolescent. Why I'm mentioning the adolescent? Because in the combined oral contraceptive, the COC tablet, it is not recommended for women above 35 to 40 years old. But with gynobil, even this kind of age can be taken, the gynobil 1.5 milligram, very safely. And gynobil also is not harmful to be taken by women, even if it is already pregnant and she take gynobil by mistake. Let me take you to the other part. What is the indication to be used for the gynobil? Gynobil can be used for a couple whom recently had sex without using contraceptive, or when they have a kind of relation and the method like condom has been broken or slipped, or a woman using oral contraceptive and she missed 3 or more of her tablets. That means it could be pregnant, but with the gynobil, in this case, pregnancy will not happen. And also, of course, women which using the contraceptive injection and her shots has been delayed for a time. And in case of the copper IUD intrauterine device, which has been missed or has been moved from the place, or due to the forced sex. So now we have the gynobil, we know the safety, we know the indication, but is there any kind of contraindication for the gynobil to be used? For gynobil, there is no medical precaution, there is no contraindication, there is no something to prevent to take the this one tablet to stop this kind of unwanted pregnancy, because it has a very high safety margin, very low side effects, and it can be used by any woman at any ages under any circumstances. And the most important, that no pregnancy test or physical examination is needed. You know very much that to prescribe a combined oral contraceptive for a woman, we should have go through a long chain of investigation and to make sure everything is okay before starting the combined oral contraceptive with her. But when we advise to take the progesterone only pill or the gynobil, which is emergency contraceptive, there is no physical examination or pregnancy test is required. And the most important also, gynobil should not be taken if the woman is pregnant. Because why? Because it will not work. The pregnancy has already happened. So and it will not induce abortion. So it has been recommended to use gynobil before the occurrence of pregnancy, before the conception, because it will stop this kind of the conception. But if the conception happened, transportation done, and the fertilized egg reached to the uterus and implanted, that means gynobil will not work at that time, because it's already the window that this medication work is already passed. And now, let me take you again to confirm what kind of indication exactly gynobil can be used for the forced sex, rape, failure coitus interruptus, which we can, when ejaculation happen in the vagina or external genitalia, miscalculation of the periodic absence from the husband or the partner, because sometimes some women, they just calculate the when ovulation will happen and they avoid her partner in this time, and due to miscalculation, the pregnancy can happen. This is also one of very common cause why pregnancy happen, and this pregnancy is unintended or unwanted. Failure of its spermicide tablet or gel or cream, and the diaphragm or condom is slipped or broken or removed during the relation. All these are common cases or common scenarios that gynobil can work effectively to prevent the kind of conception or pregnancy of unwanted pregnancy in these cases. Like any other hormonal contraception, there is some drug-drug interaction could happen, especially any drug that can increase the liver enzymes, because increasing liver enzyme will increase the metabolization of the progesterone in the tablet and may lead to decrease the effectiveness of the tablet itself. That's why in some medication like rifampicin or other medication that increase the liver enzyme, this could decrease the efficacy of the gynobil. That's why Or by the way, this happened to any hormonal contraceptive tablet, even the normal hormonal contraceptive, either it is COC contraceptive or progesterone only pill, the same theory, the same study, which is the drug-drug interaction with product that increase the liver enzyme. So in this case, we must assure to this patient or to this lady that if you are going to use this medication, please, which I mean the Gynobil, stop the other one for the time of using your Gynobil timing. That's it. And now I will take you in a comparison between the two main methods that are using nowadays, which is the progesterone only pill, Gynobil, and versus the USB. And let me remind you what USB is. USB is to use the double dose of the combined oral contraceptive, or to use it every 12 hours instead of using it every 24 hours. So Gynobil versus USB. Gynobil versus USB, this is what I mean by USB. It is the combined oral contraceptive, which used within the 72 hours, and here 2 doses of pills taken every 12 hours apart. And this also shows some efficacy to prevent pregnancy, and this known as USB method of contraception. But for the side effects of this method, if you compare it to the nausea and vomiting between the USB and the Gynobil, you will find the Gynobil is much safer from the nausea point of view and vomiting point of view. It's much less side effect compared to USB. And the most important, if we look to the whole side effect, still Gynobil is more safe than the USB, 23% versus 51% nausea, 60% vomiting versus 19% dizziness, fatigue. We still have more safety margin with Gynobil versus USB. But what about the efficacy? What I mean by the efficacy and how can be showing a good result. Gynobil can decrease the incidence of pregnancy rate by 75% if it is taken in the right time. And right time means within the 72 hours of the unprotected sex relation. First day or second or the third day. And to show this, let me maybe something or some studies showing that it could be effective to 5 days, but for assurance, it's for 3 days. And if it is used in the right time, if it is used in the right times, it could reach to 93% assurance of this preventing of this pregnancy. So range it from 74% up to 93% prevention of this kind of infection. In average, we say that it could prevent this by 85% of the cases can be prevented by use just one tablet of the Gynobil. So what is this, if we compare it first day to the second day to the third day? If Gynobil used in the first 24 hours, as we mentioned, it could prevent this pregnancy by 95%. If it is taken in the second 24 hours, that means we could reach to 85%. And if we lead it to the third day or on the third 24 hours, that means almost 58 or 60% prevention. So efficacy is there. Of course, the sooner the better. As much as you take it early, as much as the higher results you can get from the tablet. But if you delayed it to second or maximum to the third day, it's still effective, still positive, still can show very good results compared to USB. And this is one tablet, Gynobil, 1.5 milligram, that can, in a way, very high quality, security high, and very simple tablet just one at the time of the occurrence of the unprotected sex relation. So this is all from my side. Thank you very much for your attention. Thank you for your participation. I hope it was clear from my side. And now, if you have any question, I will be more than happy to answer this question.
Thank you so much, Dr. Katab. That was very, very a good one. Thank you so much. We'll now encourage our participants to ask their questions. We have some unanswered questions from the first speaker. We are going to put them all together, but now we want you to bring in your questions for Dr. Katab. Any question that you have on effective prevention of unplanned conception. Maybe I should ask my own question before other questions starts coming in. Yeah. When you were talking about gynopil, you said that it most of the time how it works, it delays the movement of fertilized egg.
Yes.
Into the uterus. Like it delays it. I want to find out. Hope it won't increase the incidence of tubal pregnancy or ectopic pregnancy.
This is a very good question. And let me clarify something. What is if you look to the normal prevalence of the ectopic pregnancy in the normal population, it is about 1%. This is the normal ectopic pregnancy prevalence. When we compare in a big mega analysis or one big study that have been showed almost 65 case of using gynobil or levonorgestrel 1.5 and how much the prevalence of ectopic pregnancy that happened to those ladies in 65,000 cases, they found the incidence is also less than 1%. That means the prevalence that happened with gynobil or levonorgestrel 1.5 is similar to the normal prevalence of the ectopic pregnancy. That means the use of levonorgestrel 1.5 not increasing the incidence of ectopic pregnancy. But from the other hand, if the woman is already predisposed to ectopic pregnancy, and by preventing the ovulation for this lady, that means we decrease the incidence of the ectopic pregnancy. But because when it comes to, because as I mentioned, the main mechanism of action of the levonorgestrel 1.5 is to stop ovulation. And the other is just helping this. If ovulation happens, so we have to stop the movement of the movement of the sperms from the cervix up to the fallopian tube. And if the sperm has passed, that means the third way, due to the peristaltic movement decrease, this will decrease the transportation of the egg to the fertilized egg, to the uterus. This is one. But the most important, that the decrease of the peristaltic movement is not a unique action of the levonorgestrel. It is for any other method, like the USB method, like the olipristal acetate. So all will decrease the movement of the fallopian tube, and that could also may help, or some cases may lead to ectopic pregnancy, which will be within the normal incidence. I hope this answered your question.
Thank you so much. We have some questions here that we'll quickly go through before we round up. Dr. Katab, one person here says, Olatuberu Mofola Shayo, is miscarriage not the same as abortion? Is miscarriage not the same as abortion? Then that's for you, sir. Yeah.
Actually, there are difference between, and I can also leave this question to Dr. Fahmy if he wants to comment, but miscarriage is something and abortion is something else. And Dr. Fahmy, if you wanted to shed some more light, I will elaborate more. You are on mute, sir.
Sorry, so we want to know the difference between a miscarriage and an abortion, right?
Okay, sorry.
That's I think my knowledge of gynecology is getting rusty now. So, but I will try and do justice as much as possible. So an abortion obviously is okay. Can I get Mr. Joe? I know do you have gynecological experience or what's your background?
RN, RM, I'm a midwife. Yeah.
All right. So because there are some details as to the definition of miscarriage and then abortion, and I don't want to give a wrong, impression.
Okay, we can, you know what, we can just keep that question for now and then we'll come back to it so that we'll not give a wrong answer. Let me just go to another question here. What is the effect? What is the
before we skip this point, because it's clearly if we want to differentiate between miscarriage and abortion. Miscarriage when the embryo, as far as I remember, and correct me if I'm wrong, if the embryo fetus is dead before the 20th weeks of the conception. So before the 20th weeks of the this is a miscarriage, and this is something not induced, but abortion is something induced. So the first difference between both, that miscarriage is not induced, but abortion is induced. This is the main difference. And the timing between both, the timing before the 20th weeks, this is a miscarriage. After that, it's abortion. So this is the difference between miscarriage and abortion. And in my slide, there was one showing that the miscarriage could happen for the intended pregnancy, but abortion usually happen with unintended pregnancy. So that means that showed you that miscarriage, something happened by incident, something happened idiopathic, something happened not intentionally by the pregnant woman, but abortion is induced action.
Intentional. Okay, thank you so much. Thanks so much for that clarification. Now, there's a question here that says, from Omobolanle Ojo, are there specific anticonvulsant drugs that could interfere with the efficacy of gyno-pill? Are there some anticonvulsants?
Yes, okay. Anticonvulsant, anti-epileptic product, like these other product that increase the liver enzymes, that also can interfere with the effectiveness of any hormonal medication, including the gyno-pill. So even if this woman taking the normal contraceptive pills, it should be also cautious about her dose, because it may use a hormonal contraceptive, and during using anticonvulsant or anti-epileptic or rifampicin or any of these products, that means this could lead to decrease the efficacy of this medication. So it should be cautious and to make sure of the dose.
Thank you so much. Emeka is asking here that how many times can gyno-pill be taken in a month? How many times? How many times can gyno-pill be taken in a month?
Yes, usually this is called emergency contraceptive pills. Emergency means this kind of emergency could happen once, twice a month, 3 times a month. This is as a max. But if this could happen more than 4, 6, 7 times a month, so it is not emergency. And in this case, this woman should use a normal contraceptive method. I mean, take a combined oral, which is taken daily, or put a device like intrauterine device or any other method. And in this case, it will not be emergency. But in case of gyno-pill, it is emergency, so it can be used once, twice, 3 times a month, but more than that, we do recommend for this woman to go for the normal contraception method.
Thank you so much. Another question here from Famakinwa Oluwakemi says, I want clarifications on the aspects of no contraindication to the use of gyno-pill. No contraindication to the use of gyno-pill. Does that mean it is safe for those who have underlying health conditions like hypertension, diabetes, and so on?
Yes. There is no medical precautions needed for the levonorgestrel in general, because look, for under the concept of the contraception, we have 2 concepts here. The concept number 1, which is the combined oral contraceptive, which is estrogen plus progesterone in 1 tablet. And in this case, a lot of precaution there regarding the age of the woman that you're going to use it, her condition, if there any concomitant disease or not. The other principle, which is progesterone only pill, in this kind of progesterone only pill, the precaution less than the combined oral contraceptive. That means the old lady can be used it if she has any kind of concomitant disease. And in emergency contraceptive, which is under the umbrella of progesterone only pill, in this kind, the safety measure or the safety margin is very high. That's why there is no precaution needed. There is no physical examination. There is no pregnancy test needed. Take the tablet immediately once if you have exposed to this unprotected sex relation. And the most important that, as we have mentioned during the presentation, that levonorgestrel leave the body completely within a few days. So there is no risk from using it, and there is no contraindication for using it.
So much. There is another beautiful question here again from Sandra. She says that if gynosil is taken after 72, gynopill is taken after 72 hours, will it have any teratogenic effect on the growing fetus?
This is
taken after 72 hours.
Yeah, this is a very, very good question. As I mentioned in my presentation also, levonorgestrel 1.5 gynopill has no effect on the pregnancy that occurred, has no teratogenic effect on the baby, has no effect on the course of the delivery. I mean, it will not affect the course of the pregnancy. So even if it is taken in case of pregnancy, it has very safe on the mother and on the baby. There is no teratogenic effect for the levonorgestrel gynopill 1.5.
Thank you. Thank you so much, sir. Emmanuel Adewoye is asking here that is this gynopill widely distributed in Nigeria, or where can we get it directly supplied from the pharmaceutical company?
Yeah, I'm actually, as per my understanding, that gynopill is very widely distributed. It is available in the pharmacy there, and our team in the on the ground can also send a lot of, at least they can communicate with the places where gynopill is available in Nigeria, and I'm sure it is freely available in the pharmacy.
Let me take maybe 2 more questions, then we go back to Dr. Femi's questions before we round up because of time. Okay. Femi is asking here that, what if ovulation has occurred? Is there any safe method of preventing unplanned conception?
Yes. Of course, we mentioned that the main way of gynopill levonorgestrel to prevent conception is to prevent ovulation. But in case ovulation happen, so still we have the chances to prevent this ovum to get fertilized by preventing the sperm to go up via the cervix, by thickening the mucosa of the cervix. That means the sperm will not be able to go up. This is one. Number 2, if the sperm goes up and went to the fallopian tube, and fertilization happened by decreasing the peristaltic movement of the fallopian tube, what will happen? the fertilized egg will not be transported to the uterus, and the pregnancy will not happen. So even if the ovulation happen, that means we still have the window for the gyno pill to work and to prevent this pregnancy to continue, or the conception and pregnancy to continue.
Okay, thank you so much. One more question here, then we go back to Dr. Femi's question. How many, are there long or short-term effects of constant gyno pill use? Tega Erukari asks that. Is there any long or short-term effects?
Short-term effect and long-term effect.
Okay.
No, actually, the short-term effect of gyno pill, the gyno pill prevent conception. This is the short-term effect. We don't have any long-term, because the long-term depending on the presence of the molecule in the body, and we mentioned that gyno pill will leave the body within few days after ingestion. That means there is no long-term effect. There is no any kind of teratogenic effect of the gyno pill. It's very safe, very tolerable, and widely available in the market.
Thank you so much. Thank you so much, Dr. Khattab. Let's ask some more questions from Dr. Femi, because we still have some questions here. There's a question here that says that, okay, we have answered this.
Yeah, I've answered quite a lot of those questions online.
Yeah, you have answered quite a lot of them. And I know that you also went through them. Maybe, is there a way you can summarize some of the answers?
We can get the answers. I think we should be able to display the answers. So, quite a lot. So they actually shared. There were so many questions. I think I would have answered up to maybe 20. How do we prevent spread of infection in newborn? Oh, what is this one?
Now, one more question for Dr. Khattab. Someone is asking here that gyno pill, is it pocket friendly? Is it not too expensive?
Okay.
I don't know exactly how much the cost of this product in Nigeria, but in the whole markets, it's very affordable, very competitive price. Here in UAE, in Saudi, in Kenya, in other countries, it's very competitive. But exactly the price, I'm not sure how much it is in
Okay. Another question here from Mrs. Phoebe Abioye. How do you intend introducing this, as in this drug, to the professionals and Nigerian pharmaceutical markets?
I didn't get the question. What?
How do you intend to introduce this gyno pill to the professionals and Nigerian pharmaceutical markets? To the markets, how do you intend
how we are going to introduce the product to them? This is the question, as far as I know or I understand.
How do you intend making them available
it is
to the market?
Yeah, it is already available in the market. I'm not just, we are not going to make it available. It is already available in the market. And our team there on the ground already working on the product. Maybe they will, in the coming time, they will increase the awareness and increase the spreading of the information and patient awareness about the product in the market.
All right, thank you. Another question here from Adiola Degbite. She's asking, if gyno pill is used immediately after an intercourse, can it be reused after 4 days following another episode of sexual intercourse?
If it is used immediately,
after intercourse, maybe
yes,
day one.
Yeah.
Then
if it is after 4 or 5 days again,
4 days.
4 days.
It will be reused after 4 days.
Yeah, as I mentioned that if it is used immediately and after the occurrence, that means the possibility to prevent this one is up to 95%. Okay, but if for the second occasion, which will happen after 4 or 5 days, another case of intercourse, again unprotected, it should be take another gynobil, because the first one has been eliminated already from the body within these 4 or 5 days. So it will not be, still not be there to be effective.
Thank you so much, Dr. Katab. I will ask one more question here so that we can round up because of time. Lois Adeyi is asking that, thanks for the lecture. How soon after the use of emergency contraception can a woman commence regular hormonal contraceptive method?
But after the gynobil,
after the gynobil.
After gynobil, if
Yeah.
she take it gynobil today, after this occasion, she can start immediately, second day, she can start her normal hormonal contraceptive, either it is COC or POP. Why? Because this COC or POP, which is the combined oral contraceptive of progesterone only pill, need time to build in the body. So to need this time, it should start immediately from the second day, the normal hormonal contraceptive for the upcoming cycles.
Thank you. There's another interesting question here from Ogun Deborah. What are the liable effects of gynobil on women with fibroid history? Women with the history of fibroid.
Usually, the progesterone only pill, it has no effect on the fibroid. It doesn't increase or decrease the fibroid. It doesn't change the fibroid from benign to malignant. So zero effect on the fibroid.
Okay, thank you so much. Before we round up at this junction, I'll encourage our participants to take the polls. Please take the polls. Take the polls at this time while we'll continue with the question and answer. Let's quickly look at some more questions so that we'll give time for them to take the poll, and then we are about to round up. There's so many questions, and just going around them to see the ones that are similar. Okay, what effect does taking ECP more than 1 month? That has been answered. Is gynobil pocket friendly and widely available even at the rural areas? Pamela Inyang is asking that. That is gynobil pocket friendly, and is it widely available even in at the rural area in Nigeria, I guess? Dr. Katab?
Yes.
Someone is asking here that is gynobil pocket friendly, and is it widely available?
It is very, very pocket friendly. It is just one small box containing one small tablet, and it is distributed in Nigeria through our partner Philips in Nigeria. And it is already, I think it has been put in the chat from our colleague in Nigeria. If you look to the chat, he already bought where is the distribution, where is the and the price and everything there. But it is very friendly, pocket friendly, and it's very widely distributed via Philips.
Okay. Last question here for Dr. Katab before we round up. How many doses of gynobil can be taken within 1 month?
As I mentioned before, within 1 month, if the occasion has happened or repeated within this month, 2-3 times, maximum 4 times, means once occasion per week. But if more than that, so it is recommended to use the normal contraceptive pills. So at least once per week.
Okay, once a week. Thank you so much, Dr. Katab. This question is for Dr. Ugunremi. Someone is asking here, Pamela Inyang is asking that about the use of the locally prepared nose mask. She's asking her that can surgical mask which has been washed and reused be said to be effective in the prevention of coronavirus? Surgical mask that has been washed.
Yeah, so ideally, surgical mask should not be washed. It's not actually reusable. So you use usually within 6 hours. You should discard and use another one. That's the standard. Now, talking about whether it can be used for coronavirus. So that's a very specific question, and then you have to look at any filter. Is talking about the size of what you want to filter. So when you talk about coronavirus, is a very tiny organism. Now, these masks or this mask, they have different filter level. So the basic one is the surgical mask, and that will filter. Obviously, it's meant for surgery, to be used during surgery to prevent splash and things like that. Then you go to the next level, like the FFP1, FFP2, FFP3. So when you graduate from the different level to different level, you have the size of the filter becomes smaller. It becomes smaller as you go. So FFP1 will filter some microbes that are bigger than the one that FFP2 will filter, and then we go to FFP3. But in coronavirus, it's very tiny. So the idea is you really want to filter coronavirus in an environment where will be in isolation room. You need to be using things like N95 or FFP3. You understand? But if you're talking about generally, we want to prevent from outside, anything, like I said, anything to protect is still better than nothing. So if you use even ordinary handmade filter, it's still better than not using anything at all, because that will prevent, if somebody cough or they spit at you, that will still protect you. So there's a level of protection there, but it depends on where we're talking about. So if you have people working in isolation center, for instance, you don't want them to say, okay, I'm using common surgical mask, because the level of the chance of being infected is very, very high at that stage. In fact, to some extent, in some of these isolation centers, in a place in some of these developed countries, where they have a negative pressure, which means that they even still they use pressure inside the hole that is negative, so they can't spread things out. So it depends on what we're talking about.
Yeah, thank you so much. I will want Mr. Ayo, please, to give us an answer about the distribution of this gyno pill in Nigeria. Mr. Ayo, please.
All right.
Mr. Ayo,
good evening, everyone.
Thank you.
Good morning, those who are outside the country. So Gynopil is marketed and distributed in Nigeria by Philips Pharmaceuticals, as I posted in the chat section. Distribution basically started February of this year. So that's why you probably may not have seen it widely. You may not have seen it in all the parts of the country, but Philips Pharmaceuticals is a very strong distribution company, and you can be rest assured that every part of the country will be definitely covered. And the average price for the product is around 500 Naira for a pack.
Thank you so much. God bless you. Thank you so much. I will want to encourage our participants to take the poll if you have not. And with this, we have come to the end of this very insightful lecture. Thank you so much, Dr. Katab and Dr. Ogunremi. Thank you so much for the lectures. They are so impactful and so insightful too. And I also want to tell our participants that I want to let you know that this webinar has a 3-point credit for you, especially nurses, for you to renew your license. So make sure you register properly if you have not, before starting this, make sure you register so that we'll be able to have your statistics, and then we'll be able to put things well, writing your certificate. So once again, I want to thank the presenters for the very, very insightful lecture. I also want to thank all our participants, all the Director of Nursing Services. I also want to say a very big thank you to Exeltis Africa Limited for putting this up during the Nurses Week. We are saying a very, very big thank you to you. And then we hope that a lecture like this will come up anytime soon again, and nurses will be very, very glad to participate. Thank you so much, and God bless you. All the other questions that are there, and somebody asked that, can the lectures be made available? We'll get back to you if we have your email addresses. And then I think some of the other, hello,
ma.
Yeah.
Hello, ma.
Yeah.
The lecture will be available on Thummimng in about 2 days time. So if they check in 2 to 3 days, the lectures will be available on Thummimng.
All right. Thank you so much. Mr. Dedamala is telling me that the lectures will be made available in 2-3 days, so that you can check your online Thummimng NG. If you are able to log on and then you check, then the lectures will be made available. So thank you so much, Dr. Femi, Dr. Katab, Mrs. Abimbola Ojo. God bless you. And let's say stay safe and keep washing our hands very well. It's just the best way to keep it out. God bless you all. Thank you.
Thank you. Bye.
Thank you. Bye-bye.
All right.
Bye-bye.